and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course,
Brad,
Bob.
today you want to talk about the sciatica cure. I'm sorry, I want to say it right, cure. And this is from the master.
The master, in our opinion, of course.
In our opinion, of course, but we're not the masters.
No.
We've learned from the masters.
Exactly.
Like the grasshopper guy.
And we're talking about the one person that we both really feel has probably made more of a significant impact on low back and sciatica than anybody else.
Oh, without a doubt.
And particularly the philosophy that he teaches, I really like, because he teaches the person how to take care of themselves. It's not like come in, get your treatment, and then go on, and then you have no idea how to help yourself at home. It's like the old thing where you can teach someone, you can give someone a plate of fish and they can eat it for one day, or you can teach them how to fish and they have a lifetime.
Fish for a lifetime.
Exactly.
And he's definitely in that philosophy. He really wants to make sure that your pain's not going to come back. He wants to show you how to do things to stop it from coming back.
Exactly. So that's why it's not going to be a really quick video, but it's going to show you exactly the concept, and it's going to make a big difference if you got sciatica on how to look at your cure.
And then at the end, I just want to make sure I'm going to link to two videos at the end. One's going to, and we'll talk about one's how to find a McKenzie therapist, but the other one's going to be how to do the McKenzie program.
Sure.
And if you are new to our channel, by the way, Brad,
Bob.
Please take a second just to subscribe to us. We have a subscribe button over here on the left somewhere. Our left, you're right. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
You bet.
So
So
where are we at, Brad?
the story about how McKenzie started the system, to me, is absolutely
this is a fascinating story.
Right. This is sheer genius by McKenzie, and not only that, but the fact that he pursued this little piece of evidence. And let's go into it. So this is Robin McKenzie. He born in 1931 to 2013. He passed away now. But in 1956, one of his patients came in with back pain and pain going down his leg, and McKenzie had just treated somebody. Why don't you stand up once, Bob? And in his treatment room, which was in a different location than where he was, he had the previous patient laying like this. And back in the day, most people were treated for low back pain and sciatica by doing the Williams flexion exercise. Very common. You know, people were working with it all the time at the time. So this gentleman came in, and he's got the back pain and pain going down his leg, and McKenzie says, why don't you go in the room and lay down, and I want you to lay on your stomach. Well, he forgot the fact that he had his table. Why don't you move again, Bob? He didn't have one of these. He had the table that came up on the hinge.
Right.
And he had the table up on the hinge like this, and he forgot about that. Otherwise, he would have never told him to lay on his stomach. Well, the patient walked in, and he saw the table. He says, well, the therapist said lay on his stomach. Why don't you do that, Bob? So if Bob was the patient, he laid like this, and he was laying there for a few minutes.
Brad, can I say something real quick, though? At this time, back in 1956, this was considered awful for your back. I'm serious. Everything that all that was, all the written that was written at the time was that you never put your back like this. It's going to make your back worse.
Sure.
So when McKenzie came in, he was horrified.
Right.
Yeah. To see him like this.
Right. So he came in and he looks and he's thinking to himself, "Oh my goodness, what have I done to this patient?" And the first thing the patient says, he says, "Oh my goodness, I can't believe how much better my back and leg feel." And to McKenzie's dismay, he went along with it. He said, "Oh, well, good.
Of course. Of course it does."
And so the pain was out of his leg. It was centralized. We'll talk about that a little more, to his back. And McKenzie, instead of just taking this and putting it off the side as a fluke, he decided to study it. And he studied it in depth for the rest of his life, actually.
Exactly.
And he started a system that actually now goes across the world. 40 different countries have established McKenzie systems where it's you can call, you can get to you can not call.
Even a lot of physical therapists, doctors, and even chiropractors are practicing this method now. So
exactly. So all from a mistake that happened in the clinic.
And his observation, but his willingness to accept it was a really kind of amazing thing, Brad.
Exactly. He was open-minded.
Right. It was at the time just anathema, as they call it. So, all right. So we should talk about
Let's talk about the centralization. Why don't you stand up and turn around, Bob? You may have noticed Bob, he had some red on his back. It wasn't by accident. So typically with sciatica, low back pain will refer pain down the leg all the way to the foot or to the toes.
Into the butt, into the back of the leg, yep. Could even go all the way into the foot.
And what McKenzie had found out is the pain centralizes, and you want it to centralize from the foot and moving upwards. In other words, if the pain from here to here gets better, but you still have numbness, pain, tingling, whatever it may be in this area, that's not how you want this to progress.
Yeah, the worst thing to see is that the pain here goes away and this pain gets worse.
Right.
What you want to see is that it goes the opposite, that it starts getting better. Why don't you go ahead and take off some?
Right, let's do that. So let's say the person does some press-ups or does an exercise and they find out that, and we're saying pain, but it could be numbness, tingling, burning, any of those
symptoms.
This goes away like that, and all we do is we have symptoms from here to here.
So right, I had just done some press-ups.
Yep.
And after doing the press-ups, that pain is better, or that tingling, or it's gone down 25%.
Right.
That's a good sign. That's exactly what we want to see.
Right. Now, if the pain goes over to this leg like that, that's not a good thing. Usually that doesn't happen.
No, I don't think I've seen that.
Let's move this pain over here.
Yeah.
Okay. So anyways, we have taken this away, so we continue to do the press-ups. And the next thing you'll want to find out, and it may be that you just change your seated posture, use a lumbar support, and it gets rid of the other pain. And now centralizing is occurring.
It might stick in the butt yet.
Sure.
Sometimes it sticks
You
there.
want me to?
Yeah,
Should we put some pain back on?
Yeah.
It would be really fun if you could treat like this, and that's all you had to do was.
So I'm just saying typical what happens. It seems like it sticks in that butt for a while.
Yeah, it does. It kind of gets in that hip area.
And then maybe a couple days later, you get it out of the butt.
You're right. So centralization, the base of the word is center. And the center is right here, usually about at the belt line, and here it is, and oftentimes it'll go here, and as it improves, it centralizes even more from that area to just one small point, and if this is your pattern, you can be smiling because you know it's going to go away.
Eventually go away.
Exactly. That's a really good idea, Bob. Thanks.
Yeah, so that's where you really want to go with this. You really want to be looking to do press-ups with that. We only got a couple minutes left here, Brad. Do you want to finish up with the model, or what do you want to do?
Well, let's go to, I really want to clear up the point that oftentimes people think McKenzie means that's all you do is press-ups and that takes care of the problem, which is not the case. If you're fortunate and it's that simple, that's very good, and a lot of times it is, but there is going to be a certain percentage, I don't know, I'm guessing maybe less than 50%, between 25 and 50%, that are going to be difficult back problems that you're not just going to lay down and do press-ups.
Right.
So, and this is where you may have to, instead of doing our sciatic videos that we get a lot of comments back where people successfully treat themselves, but if you got a tough one, you may have to go to a therapist, a McKenzie trained therapist, and let them help you out.
Right, so at the very end of this video, I'm going to have a video on how to find one of those therapists. You go to their site, and they have them, again, there's a good chance there's one in your country, even if you're from a different country.
Right,
They have them in a lot of countries, so you just follow the video, and it'll direct you to get
Right,
somebody.
yeah, 40 different countries throughout the world. And McKenzie himself was from New Zealand, and he's well known. He's got awards. He got 10 different awards, not just from New Zealand, but from the United States, from the United Kingdom, and around the world.
Can I make one other point, Brad?
Sure.
Just to interject this right now. If you're getting pain down your leg, like to your knee, that does not mean sciatica always.
That's true.
And that's why sometimes when you see a therapist, they might even have you do flexion. Maybe it's just as simple as arthritis,
right.
and the flexion might even feel better on that.
Sure.
So don't think just because the pain goes down to the knee. Quite often, any regular back pain can go down to the knee.
SI pain.
Sacroiliac pain.
Usually doesn't go below the knee, but oftentimes can go to the knee.
Right.
I had one person had pain all the way down the leg. We were doing press-ups, all these types of things. She ended up having a hip replacement.
Yeah.
That was the problem.
Yeah.
So
it's amazing what can send pain down the leg.
Right.
Yeah. So
why don't you just lay down quick, Bob? I'm going to show a couple on your stomach, please.
Okay.
So, as a therapist, a therapist might come in and actually do some manual therapy where we're holding support here and we might be going in different directions. This is a skilled thing. You're not going to do this by yourself, and this is where a therapist will get you the gains that you need or the progress. You might be shifting your pelvis over one direction. You might be doing the roadkill, Bob. There, like that. Oh.
Yep.
Beeper's going,
Yep.
Bob, we got to finish up.
Well, I'll tell you the other thing, Brad. Again, I'll put our playlist at the end of Sciatica.
Right.
And it's got all sorts of videos on how to do the actual McKenzie technique.
Right.
Give those a try. You get stuck, find a therapist.
Exactly.
Let's leave it at that.
Okay.
And remember, we can fix just about anything, Brad.
Yeah, but we're working on that
Broken heart. We
heart.
can't fix a broken heart.
We're going to get it though, Bob.
Yeah, I know we are. Thanks.